Well, good afternoon, everybody. My name is Rachel Rosofsky. I'm a hematologist at the Massachusetts General Hospital, and I'm on the Scientific Advisory Board for the National Blood Clot Alliance. And thank you for joining this webinar Facebook Live on pregnancy and thrombophilia. I'd first like just to thank Grifols for their support of this program. I also want to let you know that the National Blood Clot Alliance has resources and videos on their website about pregnancy and thrombophilia. So if you are not aware of that and haven't visited that site, please do that. And I want to introduce our speakers. So we have three amazing women who are going to talk about their personal experiences with thrombophilia and pregnancy. We have Danielle, Jessica, and Sarah, and just thrilled and honored to have you here and share your stories. Thank you so much. So we're going to start with Danielle. Danielle, if you just want to introduce yourself and just give us a story of kind of what happened to you and how you ended up being one of these presenters.
Sure. Thanks for having me. So I have hereditary antithrombin deficiency. I found out when I was 19 years old. We knew that it was in my family, but I personally hadn't gotten tested to see if I also had the deficiency. I had just gone on birth control when I was about 19. Within 6 months, I started to sort of notice a change in my health. I was starting to get really winded. I was a college athlete, and things just sort of weren't aligning with how I was feeling. But as a 19-year-old, I didn't really think much of it. I went for a run with my roommate, and right as we stepped out the door, I ended up collapsing. When I got to the hospital, they found out 98% of my lungs were blocked with bilateral pulmonary embolism. I was given TPA to break up the clots, ended up having a greenfield filter put in because despite breaking up the clots, they kept forming. I spent about 2 weeks in and out of the hospital and ended up with a DVT after the filter was put in. So that was my initial first experience with having blood clots, which was a lot for a 19-year-old to kind of take on when you're in college and, you know, not really necessarily knowing what's going to happen and where things are going to go. I knew that I was going to be a lifer on anticoagulation because of the filter. It's a permanent filter. I knew that it was time to think about having children. There would be some different things I would kind of have to handle. The first time I got pregnant, my oldest son now is 11. I went on the injectable the injectable anticoagulants, ended up switching over to heparin when I went in to be induced. Had a very easy pregnancy throughout that. Even the delivery was no issues. But then 3 days after I delivered my son, I ended up with a full leg DVT again. So kind of figured that maybe I wasn't on enough anticoagulants after I had my son. Wasn't really sure, but overall, you know, I kind of just recovered from it and went about my business. 2 years after that, unfortunately, my brother also has had antithrombin deficiency, and he unfortunately passed away from a stroke from it. That kind of led me into doing a little bit more research. I was put in touch with a hematologist for my son to get him tested, was put in touch with another maternal fetal medicine specialist when I had my second son. And during that pregnancy, I ended up having the antithrombin replacement therapy through the course of my delivery, sort of doing the injectables during my pregnancy, then the heparin, then the antithrombin replacement therapy. Ended up delivering my son, no issues again. 3 days after I got home, I ended up developing another clot. So I've had a lot of experience between pulmonary embolism, DVTs, sort of navigating the whole space, and you know, not necessarily something that people want to experience, but you know, happy that I have the knowledge and I'm able to share what I've gone through and sort of how I've navigated the process.
Well, first of all, thank you so much for sharing that journey of your thrombophilia and clotting history. That's just so incredible that you had three. So really, I mean, you talked about your brother and other family. So there's obviously a common thread here is family history and that you have this
Yep.
inherited thrombophilia. I'm just wondering, did you know how important that was when you were, I mean, you said you were 19 and you were running, you were short of breath. Did you have any knowledge when you were 19 that this was an issue and that you should be concerned about and that what the signs and symptoms were? When was
I
that?
I mean, I don't think I put two and two together at 19. You know, my mom has the deficiency, and even she and I had the same gynecologist. It wasn't even a conversation that anybody had with me about what to pay attention to. Um, After it happened, it was like, oh, whoa, wait a minute. And then now all of it, everything you hear now about, you know, the testing for blood clots when you're on an oral contraceptive and then family history, you know, it's eye-opening where I was back then and sort of how it wasn't something to pay attention to. And now it's really important
Hmm.
um,
Hmm.
to really pay attention to that kind of stuff.
Yeah, yeah. Well, I mean, antithrombin deficiency, as you know, is one of the
Hmm.
rarest inherited thrombophilias and almost, equally as important as that family history that you have. And
Yeah.
it's amazing that your mom had it. And, just it's so important to educate and just everybody on this Facebook Live, just to know the signs and
Mhm.
symptoms.
Yep.
You're 19, you didn't even know that, oh my God, you could actually be predisposed to getting a blood clot, and these are the signs and symptoms that you really need to watch out for. And then
Yeah.
what you could have done preventively to
Yeah. And,
prevent that first blood clot.
I think back to it too. My roommate in college, she was sick at the time. I thought I just had the cold that was kind of going around the dorm. I didn't
Hmm.
necessarily think, oh gosh, this could be something worse than what it actually is.
And I think you bring up a good point in that your roommate had symptoms that were similar to yours, and people that develop pulmonary emboli, it
Mhm.
has it's called the great masquerader. There's so many
Yeah.
symptoms that can be associated with PEs that can also be associated with other things. Shortness of breath. Maybe you have pneumonia. Maybe you have
Mhm.
asthma. Maybe you have allergies. Maybe you're deconditioned. So there's so many other things it could be,
Mhm.
and if you're not aware of that, and again, your strong family history. So going back again, I just want to focus a little bit on when you were
Yep.
19. What do you wish somebody had talked to you? Like what, going back to that time, what would have been helpful for you at that time?
Um, I think going back to that, I would say, trust your gut if something doesn't feel right. I It's kind of like when I look back at it now and I'm like, wow, if I had just paid attention to some of the symptoms that were going on and actually thought, well, just go get checked. I think a lot of time people can be hesitant because they don't want to cause any issues or they don't want to like put any pressure on like family members to help or sort of pick up maybe some of like the daily weight that you have because you have to go to the doctor or you have to go get checked or I think I was worried I was overreacting and I think that that's like a big thing that I wish if I had gone 2 months earlier would the situation have been different kind of. I mean, thankfully
Mhm.
I'm here, I made it through all of the issues that I've had, but that isn't always the case. So I think acknowledging things when they're first starting to happen and
Mhm.
not brushing them aside is something I wish that somebody had really kind of conveyed to me
Mhm.
back then, because now it's like I go all the time for something now. Definitely don't wait anymore.
Yeah. Now, I remember you told me that you were on oral contraceptives at the time that
Hmm.
you had your blood clot. And it's interesting to me. I mean, when we know that people have such a strong family history, um, and or a thrombophilia like you did, especially antithrombin deficiency, when you were prescribed those, was that something that was talked about? Did you even know that maybe this was a risk for you?
No, I mean, it wasn't even, I think back then, I mean, it was 20 years ago when I went on it. Back then it was, well, we know that your mom and her generation has it, but we're not really too concerned past that kind of. And so what the testing wasn't as available maybe or at the
Mhm.
the initial thought process.
Mhm.
I mean, I went on the birth control and with 6 months this happened, so I mean it's not like there was a long time frame in between when I
Mhm.
started.
Mhm.
It was but it pretty much, I would say it
Mhm.
was instant kind of, the
Mhm.
changes started happening.
Mhm. Mhm. Yeah. Well, again, I think that speaks to knowing your family history, number one.
Mhm.
And if you have a family history of blood clots, to really talk to your providers about what the best
Yeah.
and safest birth control is for you.
Yes.
And clearly for you having the anti-thrombin deficiency, but even more so having that really strong family history
Mhm.
would be a reason to think that estrogen might not be is not the safest one for
Yes,
you,
not stay
as
away.
we found out.
Yeah.
I want to jump forward to the pregnancy, because so
Yeah.
now you knew that you had this
Mhm.
clotting problem. What were the conversations you had with your doctors about getting pregnant, and what information did you need to know? What were you told? What were you worried about? Can you tell us a little bit about that?
Yeah, I mean, I think right off the bat, when I would had the initial pulmonary embolism and everything, it was always, well, when you want to have kids, you're gonna have to go on some sort of blood thinner. It was an initial conversation that had to be had, make sure that you talk to your OB about it, make sure, you're considered high risk and you get like that maternal fetal medicine specialist. Those were always the conversations I had with my hematologist at the time. Um, he was a big advocate in helping me with that kind of stuff. I did actually have one primary care doctor who told me I wouldn't need any coagulation while I was anticoagulation while I was pregnant, which that to me, I was like, that makes no sense from anything I've heard, So I think you have to really do your research. I ended up switching doctors after that one told me I wasn't going to need to be on anything during my pregnancy. Um, so I think just being an advocate for myself, and after going through it, through all of the things I went through when I was 19 and being with a hematologist for, almost 10 years before I had my first son, I had a lot of those conversations, and it was sort of really, drilled into my head that when it came time to have kids, it would have to be something that I needed to be aware of, and, understand that it wouldn't be as easy as it could be for other people.
And making that decision, how did you make that decision to get pregnant, not get pregnant? Were you scared about it? What were your feelings behind
Um,
that?
I mean, I think there was like that inherent fear, like what if something went wrong? Um, I, I I knew that I wanted to have kids, and I figured to myself, oh, injections for 9 months, well, it could be a lot worse. I had been through a lot worse. So for me, thinking about doing injections for 9, 10 months, however many it was, it didn't feel as I guess like stressful or strenuous
Hmm.
as what I had been through. So in my circumstance, it wasn't too hard of a decision for me
Hmm.
to kind of handle, because I had already also been on those injectables when I came out of the hospital the first time. So I
Hmm.
already kind of knew
Hmm.
what to expect, and
Hmm.
knew it wasn't the end of the world, not
Hmm.
enjoyable, but manageable.
Hmm.
And that eventually at some point I could switch back over to regular pills. And this is just kind of the course that I had to take, and
Hmm. Hmm.
just understand that that's just what it was.
Hmm. And I think in yours in particular, thank you for sharing that.
Yep.
Then even having this information, you got recurrent blood clots.
Yeah.
Um,
Yeah. I mean,
so this.
that was kind of a shock to me. I didn't think that that would happen. And with the first after my first son, it was a full leg
Hmm.
DVT. It wasn't,
Hmm.
I mean, it was just, and it was instant. I knew everything that was happening because I had had it the first time. I knew something wasn't right. And, even when I went into the emergency room to say, I just left here, I now think I have a clot, they were like, oh, I don't know, just they weren't, all that,
Hmm.
not that
Hmm.
they didn't believe me, but I
Hmm.
knew something wasn't right. And
Hmm.
sure enough, it was right there. So,
Hmm. And then it seems like with your second
mhm.
child, they then had a different plan, but even
Yeah.
despite this new plan, you still had a blood clot.
Yeah. This my second one was a little bit more stressful for me because my brother had just passed away, and I was going through the whole process of, the thoughts of having a clot again and dealing with everything. But I felt with the doctors that were with the second time were extremely knowledgeable in terms of the antithrombin deficiency. they had been involved maybe in some of the studies to try to like work through the replacement therapy. So I felt really confident with them that they were going to handle my situation differently than the first time. But even with that, you know, there's things can come up.
Yeah, yeah.
Thankfully, it was not nearly, it was just a partial, so it's just a partial clot. But
Yeah.
um, you know, it was just, you know, it's a tough decision. I mean, now when I was thinking about having a third, you know, it's just that's when it's like starts, you know, every single time you think about things in different ways and just assessing all of the knowledge you can collect.
Well, I think you bring up a good point, and I think again, family history of blood clots, but in particular,
Mhm.
your hereditary deficiency carries very high risk
Yeah.
of clotting. And you know, in order for heparin to work, you need the antithrombin three. So
Yeah.
even with that, and I think you know, if you are someone that has antithrombin three deficiency, it's just so important that you know your risks, discuss with your doctors, make sure you get a specialist. I mean, you even said you had one doctor and you said that's just not right. And fortunately you did a lot of reading,
Yes.
and had knowledge to know that that was not right. So I think it's so important for people to know their risks and discuss with their
Mhm.
providers what those risks are, and really having an action plan. How are we going to, you know,
Yeah.
do this? And then knowing the signs and symptoms of things that might, you know, in case in, of the blood clot, I think are so important.
Yeah, and I
Um,
think it's like, you know, really just trusting your body. Like, you know, if your body doesn't feel right when something's happening. I think that was been the biggest thing for me is just
mhm,
really acknowledging how I'm feeling about things,
mhm,
regardless
mhm,
of what people, a doctor
mhm.
is going to say or
Yeah,
whatever the case may
yeah,
be.
yeah, yeah. And we had a few questions. Somebody said that if they had a filter in, can they
Mhm.
still have the injectables? And having a filter isn't a reason not to have the injectables. And then somebody else asked about getting kids tested, and it's very important to get, you know, like
Yeah.
you're gonna get your kids tested. But I do want to say, having had a blood clot, even if one of your kids does not have the deficiency, just having the family history in and of itself places people at higher risk. So just be aware of that,
Yeah.
as well.
We actually got my kids tested.
Mhm,
That's kind of how I found like the second doctor, and both of my boys both have the deficiency too.
mhm,
So,
mhm,
you know, I just feel like the more knowledge that we now have as a
mhm,
family is just going to
mhm,
help them
mhm,
down the road kind
mhm,
of as they
mhm,
navigate things that come up for them.
mhm,
So,
mhm. Well, Danielle, thank you so much for telling your story.
yeah.
If you were to kind of give one takeaway message
Mhm.
saying, you know, of all the things that you've learned or what's been most impactful, important to you, what would you want to tell the people that are listening right now?
I would say just trust your gut when you're dealing with your health and how you feel about things. If a doctor isn't making you feel comfortable, you know, you can always get a second opinion. But, you know, do your research, try to understand the clotting factor you have, the deficiency. Just from my experience, they're handled in different ways. And so it's really important to understand what you have. A lot of times people don't advocate for themselves enough, or doctors may not have as much information as maybe somebody else does. So if you go in prepared, it's going to make your experience a
Mhm,
lot better. And
mhm,
I would say also don't be scared to have kids if you have a clotting factor. You know, I've done it a couple times now, and you know, it's all come out okay. You know, and so I just, you know, just don't be afraid and advocate for
mhm,
yourself,
mhm,
and you know, things will turn out okay.
mhm. And I think a few things. One is there's a lot of great information on the National Blood Clot Alliance website about
Hmm.
thrombophilia and thrombophilia in pregnancy also. But really important for you, and anybody, you know, you had a blood clot when you were on oral contraceptives, and automatically when you're pregnant, the amount of estrogen your body
Yeah.
makes is, you know, several fold of what you're getting in that little pill. So really important that that you do speak with physician, and that you do have, I would absolutely recommend people get a hematologist if they had a blood clot already on oral contraceptives and thinking about getting pregnant, and having someone, you know, an OB that is familiar with this and knows how to
Mhm.
help patients with history of blood clots. But really important, like you knew yourself, like I needed to be on something, and that's a
Yes.
really important message. And and really finding the people that would let you do that. Well, thank you again, Danielle,
Thank
for your
you.
story. We're going to move to Jessica. Jessica, welcome. Thank you so much. And again, if you can introduce yourself and tell us a little bit about your story.
Sure. My name is Jessica McElroy. I'm a board member of the NBCA. And my blood clot story started when I was in law school. It was my third year. I was 28 years old, and I was running all around Manhattan. I was working as well as being in class. And it was the end of the week, and I remember, I had to go from work to class, and I felt a lot like Danielle said, just really run down. Maybe I had the flu, or it was February, so just bad weather, winded, short of breath, things I don't normally feel, but weren't, too drastic. And then on Friday morning, I remember waking up and I didn't have class or work that day. And I felt just like, oh, this is it. Like, I'm going to have a bad weekend. And I remember the worst of my symptoms were I had a tremendous amount of neck and shoulder pain, which I didn't know at the time was referred pain. But I was just sitting there with like a heating pad, thinking like I had strained something. Just feeling like sort of a general like pressure in my chest, like when you feel sick, and then I started coughing violently, and then I started coughing up blood, lots of blood, including bits of tissue. And so when you don't previously have any history of medical problems, you tend to panic and freeze and think like rationalize it out of a way like, oh, this could be anything. So I realized, I talked, both my parents are nurses actually, and I had spoken to them, and blood clot didn't even occur to them. I was 28, I had no family history of clotting. I had been on birth control, both oral contraceptive and the NuvaRing for about 8 to 10 years. Never had anything previously, like this before. So I went to an urgent care. One of the doctors there who saw me said, this sounds a lot like a PE. You're young, you don't really have any risk factors, but that's really what it sounds like to me. So we're going to send you for a CAT scan. So I went to the ER, got a CAT scan, and it turns out that I'd had a DVT with a saddle embolism. So my heart rate was, my heart had been compromised, and I had bilateral PE. So that was a very, it was, like I said, never had any sort of health problems before, no family history of this. And so it was just a lot of information to take in right away. Like, why is this happening? And, what is causing this? And, how do we move forward from this? So I spent about a week in the ICU dissolving the clots, was on the injectable Lovenox, and then I started a year-long anticoagulant therapy on Coumadin. I was a terrible Coumadin patient. I could not stabilize my INR. It would go really high, and my doctor would call me and be like, you're not skiing or anything this weekend, are you? And then it would go too low, and we'd have to, adjust the dosage. And I spent about, a year with just multiple weekly blood draws and things like that. So my normal life just totally upended, overnight for about a year. And I was told the same thing, when you want to get pregnant, you're going to have to go back on some sort of anticoagulant therapy. At the time, though, my health insurance did not cover genetic testing, so I didn't have a diagnosis. I didn't even really see a hematologist. It was a pulmonologist that I dealt with mostly. And someone said, well, you obviously have something, or it's a fluke or whatever, but, hormonal birth control is, off the table. So, I haven't been on it since I was, 28. And then after I got married and we started talking about having kids, I decided, it's time that I really understand what's going on. And I went for genetic testing, and turns out I have the factor 2 clotting deficiency. And I took that knowledge to my OBGYN when I got pregnant and said, what do we go from here? And we started the injectable Lovenox, and then switched to heparin at 36 weeks. And then I was induced. And I had a smooth sailing pregnancy, and I have an 8-month baby boy, and his delivery was mostly smooth. I didn't do well with the induction. Had a very strong reaction to the Pitocin, but otherwise he came out fine. And then we do the 6 weeks of anticoagulant therapy afterwards, and thankfully I have not had another clot. It's crazy to think though that if I hadn't had my clot when I was 28, obviously it was a very traumatic experience, but if I hadn't happened, I wouldn't have known that I have factor 2, and possibly something would have happened in my pregnancy that would have possibly, hurt my baby or me. I wouldn't have been so lucky. So thrombophilia is a sort of strange thing to be living with, because at least in my condition, it's not treatable unless it's happening. And you definitely sort of live under this cloud of, could it happen again, and will I catch it early enough? And and having another kid could, just anytime you're in this hyperhormonal state, you tend to, it's always in the back of your mind that this that it could happen. But that's my story. Yeah.
Well, Jessica, thank you for sharing that. And that sounded very scary when you were when you were younger, to have that and suddenly be coughing up blood and not knowing. When that happened with you, had you ever heard of a pulmonary embolism, and did you know anything about it? And is that something that because you said you don't have a family history of it, right? No one in your family? Okay. And so you probably, did you have any knowledge of what that was?
No, not at all. I mean, I knew about blood clots, and I knew that, when they enter your core circulatory system, with your lungs, your heart, or your brain, obviously, that can lead to stroke or heart attack, or, obviously, a myriad of things. But no, I didn't. And, there was no warnings when I went on birth control, right out of high school. It was just easily, it was just prescribed to me. So I had tried a different, I had some endometriosis as well. So my, my menstrual cycles tended to be extremely heavy. And so I tried lots of different types of pills, but never had any sort of warning or conversations with any doctors about clotting, or the potential, if I even had a history of blood clots in my family. So no, there was really no information pre-clot about, risks.
Yeah. So I think that raises the importance of, again, knowing the signs and symptoms of blood clots, and also, before going on estrogen, is to make sure that you talk with your provider about, hopefully, not many people will read those tiny little print that comes in the packet, but blood clots are a potential risk associated with estrogen. And really, if you are starting birth control that contain estrogen, it's important to know that those risks. And then you did say a little bit about, if you don't mind, thinking about the fear around it, and the concern, and that kind of mental angst. Can you talk a little bit more about that, and how that might affect you, and what helps you?
Yeah, so I remember after it happened, and I got out of the hospital, and I started going in for, my blood draws and my follow-up appointments with my pulmonologist, and talking about Coumadin and what it was going to be like and things like that. I only really had one massive question, which was, is this going to happen again? How do I know? Can you give me like a number, like a chance, a percentage of the chance that it'll happen again? And no one really could. And I think for a long time, it was also this crazy time in my life. It was my third year of law school, and I had to graduate and take the bar. And, I was dealing with all of this, and it was just really easy to sort of like ignore it for a little bit, because that was the easier thing to do. But, as I finished my anticoagulant therapy and started thinking about having kids, it was definitely, I was scared to get pregnant. because like I said, I had so many people tell me, oh, saddle embolism, you know how lucky you are to survive those? People don't survive those. And I was just like, thankfully I was in good shape. Thankfully I was, young enough, and, thankfully I got to the hospital in time, but like, what if I didn't this time, and I'm already, I was 36 when I got pregnant. I was already in the sort of like higher risk category. And so, it definitely weighed a significant amount of my decision whether or not to get pregnant. And how I dealt with that, my husband didn't know me at the time when I had a clot, but him being present in all of my doctor's appointments where, I would tell the story and I would tell the history of it. He was like, this is bad. I didn't realize, this was that serious. I was like, yeah, it's definitely something that you live with. And, and unfortunately, like I said, you don't know what's happening until it's happening. And, it's hard unless you're actively preventing it, like when I was pregnant and you're on the anticoagulants. I'm not a lifelong, as of now, a lifelong anticoagulant, user, unless I'm in this hyperhormonal state. So it's definitely just something that you kind of have to know, that if you are scared of having this clot, that there are resources available to you and there are people to talk to. Like, I've definitely moved away from being 28, sitting on the couch, coughing up blood, for panicking that, this is probably nothing and it'll just go away, to, actually seeking help and getting answers. And, I think that's just the best thing that you can do to combat this kind of anxiety, which is just educate yourself to the best that you can, and try and get rid of as much as possible the fear of being a burden on anybody, on your doctor, on your family, on your insurance, anything like that. Just that if knowledge is going to in any way mitigate your fear, your anxiety, then, unfortunately, one of the burdens of thrombophilia is that you have to educate yourself on a lot of it. At least I did. I didn't. I don't know if it was just the doctors I had at the time, or just a general lack of understanding of my combination of symptoms. No family history, things like that people just sort of chalked it up to a fluke. Like I said, I didn't live so long without a diagnosis, and then I finally just decided, like, I need to know, and so I went and got genetic testing, and that just really made me feel a lot better.
So just to take a step back, thrombophilia is an inherited predisposition to clotting. So it's things that you inherit from your parents, and there's 5 known inherited ones that we're familiar with, which is the antithrombin 3 that Danielle had, prothrombin G mutation, which is the factor 2 that you have, and then there's one called factor 5 lead, and then protein C and protein S are the other ones. And I would say that the most common one is factor 5 lead, and the one that you have is the second most common one. And when you have those, having those inherited thrombophilia actually doesn't cause a blood clot, but it puts you at a much higher risk of getting a blood clot. So I think, again, that information, so having that actually didn't cause your blood clot, but it put it at a high risk. And then you added estrogen, which was that high risk. Right. And that combination just placed you at a very high risk of clotting. And same with Danielle, having the antithrombin deficiency, and then you added estrogen, placed you both at a really high risk. So again, just information about that and knowing what those potential additional risk factors are. Other things like smoking. I mean, smoking can increase and as well as obesity. So, things that you can do, that people can do to decrease their risk, is not smoke, and then just really understand the side effects and, like we said, the signs and symptoms. Very quickly, just to answer a few questions, someone asked if you could breastfeed on postpartum anticoagulation. You absolutely can. There are certain ones that you can't, but the low molecular weight heparin is fine to do that, and Coumadin, but not the direct oral anticoagulants. And then somebody asked, how quickly do you have to start a blood thinning injection when you become pregnant? It really depends on what your risk is. So for the two of you, Jessica and Danielle, you both had blood clots while on estrogen. So any of my patients that have had blood clots while on estrogen, if they do want to get pregnant, I do tell them as soon as they know that they're pregnant, that's when they should start the anticoagulant. if you have one of these inherited predispositions or family history and you've never personally had a blood clot, oftentimes we don't do blood thinner during the pregnancy, but we will do it afterwards. And it depends on how many other additional risks you have. And so if there's other risk factors patients might have, we may very well do something like that. But I think this speaks to the importance of really having a specialist. So having a hematologist and making sure that you do have an OB that is familiar with people with blood clots, whether it is thrombophilia that's been diagnosed or just family history. So Jessica, thank you so much for sharing all that. And I would like to ask kind of what, something I asked Danielle, if there was a take-home message for the people listening, what would be kind of the most impactful thing that you would want people to know? I know you talked a lot about things already, but what would be your kind of take-home message?
Yes, I think, continuing this theme of knowing your risks and educating yourself and trusting your gut, it can be a little strange talking about things that you maybe aren't entirely sure of. So, I knew I'd had a clot. I knew I had the factor II, but I didn't really know what other questions to ask my doctor when I got pregnant. And I just sort of assumed that he had all the information that he needed to treat me. And it wasn't until the end of my pregnancy when, I wasn't treated by a high-risk doctor during my pregnancy. I wasn't treated by a specialist. It wasn't until the end of my pregnancy when he said that he had talked to another doctor and she told him that I should be induced a week before I was induced, that I had sort of done myself a disservice in terms of getting the information about being pregnant with thrombophilia. That it's like, it was too late to ask all these questions because I was already 38 weeks. But I do wish that the takeaway I would say is, if you want more advice, if you want more doctors, if you want a second opinion, if you want to test, if you want, ask for it. And I think as a woman, it's a little daunting to, maybe ask, especially, my doctor and I have been together for 10 years. He's seen me, he's been treating me all these, a decade. And, I didn't want to second guess him, but I wish that I had maybe sort of let go of some of that, like, anxiety about appearing difficult or appearing like a burden, and had just asked point blank, like, should I be seeing someone else? Like, are you enough to treat me? And and that that last week, knowing I was going to be induced and what that was going to be like was, wasn't related to my thrombophilia, but it was anxiety inducing, which is not how I wanted to go into my delivery. So I would say, examine your situation and know what you sort of visualize the goal and see how you can get there. If it's more doctors, it's more conversations, more research, then just go ahead and do it, because you're your own best advocate.
Well, thank you for sharing that. And I think you're right. I mean, I think a lot of times, exactly what you said, you've been with somebody for 10 years and you didn't want to second guess them, but you also didn't even know that you should be. What information. So again, that knowledge is power, and really having conversations and saying, what do I need to worry about, and how, what are the side effects? This is going to affect my delivery, and really kind of getting all of that information. And so thank you for sharing that, and thank you for sharing your very powerful story. So we're going to move on to Sarah. Sarah, thank you so much for being here with us today. And similar to Danielle and Jessica, if you can just tell us kind of your story and your journey with clotting and thrombophilia and pregnancy.
Okay, well, thank you for having me. Similar to, well, I guess Jessica, I didn't know about the family history, and I had a baby and breastfed her and got on oral contraceptive for about 9 months. It was the one you can breastfeed on. And as soon as I stopped that and started weaning her from breastfeeding and got on a low estrogen birth control, within 2.5 weeks of being on the low estrogen birth control, I started having what I thought was symptoms of the postpartum depression that I had been diagnosed with, which was like feeling like I was having a panic attack all the time, shortness of breath, tightness, feeling like my muscles were stiffening up, like something, And so for a few nights in a row, because of the stiffness in my neck and my shoulder, my husband and we did some stretching at night to try and alleviate the stiffness. Then I started taking Benadryl because I have a history of asthma and allergy induced asthma. So I took the Benadryl maybe 1 day or 2 days, and I still noticed that it was tight. My chest was tight, like I was wheezing, and I was coughing, and I was very, very shortness of breath from not doing much. And so finally, after about 3 days of that, um, I went to lay down to go to sleep. And as soon as I laid back, I got a sharp Charlie horse like pain in my chest and in my flank. And I sat back up because I couldn't breathe while I was feeling that pain. It took my breath away. And I told my husband that I was going to sleep on the couch sitting up because that was pretty much the only way I could sleep at that point. So I attempted to do that for about an hour, and I realized that I couldn't even sit anymore. The pain was like radiating. And every time that I took a breath, it was getting worse. So we, obviously called 911. They gave me some oxygen on the way to the hospital. I got into the emergency room. They put me in the triage right away. Sorry. And once I got into the triage, the nurse came in to do an EKG. She didn't do the EKG because I couldn't lift up my shirt. And so another person came in to do it. They did it. And then they gave me a Tylenol and they let me sit there. And about 3 hours later, someone woke me up because I pretty much either fell asleep or just I fell asleep, I guess. And someone woke me up to take me to an x-ray. They did the x-ray and then came back eventually after doing that and said, with discharge papers, said, must be a muscle spasm. You have, we don't see anything broken. And, you just go home. You gotta go home, follow up with your primary care doctor. And I said okay at first, but then when I couldn't walk, when I got down to leave, I pressed the button and called the nurse back and told her that I would like to speak to the doctor because I literally couldn't walk. And I still had trouble breathing. And so the doctor did come in and she said, we've done blood work. Your blood work looks good. We've done x-ray. Nothing's going on in the x-ray. We're just assuming it's a muscle spasm. And I said, I've had muscle spasms. I used to be a cheerleader. I know it's not that. I've been through that before. It doesn't feel like that. And she said, well, what do you think it is? And I had a cousin that was 21 years old, recently had passed away suddenly. And no one in my family knows to this day why, but around when she passed, I started looking up reasons just in my own time. And so when the doctor asked me what I thought it could possibly be, I said, oh no, maybe a blood clot, because that was one of the things I had saw that could cause somebody to suddenly, just pass away like that. So I told the doctor that, and she said, well, we can do a CT, but your insurance is probably not going to cover it because we don't really think you need it. But, but if you want it done, we'll do it. So they did it. And she come back crying and she was very emotional. Sorry. I'm like, what's going on here? She's like, you know, we're gonna try to save your life. And I'm like, okay. And she was like, you have, she explained to me then, but now I know what, I don't think I heard it then. I just knew what she was saying was that I had a clot, but I had a bilateral pulmonary embolism, clots in both lungs. And so they took me to the other side of the hospital, like in some kind of room, and she said they were gonna give me something to start dissolving the clot. They hooked me up to the IV. And so once that happened, about 6 hours later, they finally I think it was like 6 or 7 hours later, they finally gave me the clot buster, is what they gave me. And then I was still, at that point, I was like excruciating pain, like worst ever pain. And they gave me morphine, and the morphine made it worse because it slowed my breathing down so much. And then all the anxiety, kicked in too. So it was just so much. And so, they admitted me, and eventually, I think like the second day of them admitting me to the hospital to help with the clot, dissolve the clot, they took me off of the morphine because the doctor that was doing rounds figured out that it was making my breathing worse. And that did help me a little bit. And I was in the ICU for about 15 days.
Wow.
Yeah. Followed up with hematologist right away. Didn't find out about factor V diagnosis until 6 months later. I didn't know about family history. I do know that a couple of family members had clots before, but no one had told me that they had factor V, like a clotting mutation. As far as being pregnant with thrombophilia, fast forward to last year, I found out I was pregnant during the pandemic because my husband's vasectomy got rescheduled, and he was home for 2 weeks with me. So anyway, so found out I was expecting, and I had a mental meltdown because I had already found out that my hematologist is excellent. And she, told me, if you're going to get pregnant again, it's high risk. I am obese, and I have had the clot before, and I have the mutation. So she was like, so I found out I was pregnant, and I got scared. But I will say that my doctors, my OB is a high risk doctor, and my hematologist worked together, and the perinatologist at the end of my pregnancy. During my pregnancy, I did take the injectable anticoagulant, and I got induced exactly at 38 weeks. And my daughter her birth weight was, it was very low. And she had jaundice. And so I don't know if anything happened in her, but I'm just glad that she's here safely and that I safely delivered her. But my doctors did work together to get me through the pregnancy. And I was like, because I thought I was going to die the whole time. Like, I mean, that fear did set in.
Yeah. Sarah, wow, what an incredible story. I mean, the whole thing, I remember you telling me that when we first met about you wanting the CAT scan and then telling you that they weren't going to order it because your insurance wouldn't cover it. And again, you having that knowledge that your, that your cousin had died and that you just started the birth control. And so thank you for sharing that. That was incredible, and just advocating for yourself. Also, just really, had you not done that, I'm not sure you would be with us today. So, so if in thinking back of all of this, what do you feel like would have been helpful for you to know before all of this? What would have helped? What do you think would have helped you?
I think that if I had have known my family history, but it would have helped me. And then I think what would have helped me as far as like, if I had have known what the signs were, I kind of had an idea, but I did not think it could happen to me. and I didn't know my family history as far as the mutation, the genetic mutation. So if I had have at least known that I had the genetic mutation when I showed up in the ER, or before I even showed up, when I started having symptoms, I probably would have gone in sooner, because in hindsight, I wonder sometimes if that could have prevented some of the residual effects that I am experiencing now because of the lung damage, but I don't know. But I would say if I know my family history, and that probably would have helped me to make different decisions.
Yeah, I think that's so important. And again, the family history. So we've been talking a little bit about the thrombophilia, and just to clarify, there's inherited thrombophilia and acquired. Inherited are the ones we mentioned, and the three people on the call right now have three of the inherited thrombophilia, and up to about half people who present with blood clots actually have one of these thrombophilias identified, one of the inherited ones. And so, and just to, the factor V Leiden is actually, you probably know this is the most common one, about 5 to 12% of the population. It's higher in kind of Greece and Sweden, and it is the most common one. But most people with factor V Leiden aren't necessarily gonna get a blood clot. And so it's really, the antithrombin 3 deficiency, even though that's much less of the population, like less than 1%, if you have the inherited antithrombin deficiency, up to about 50% of people that have that will develop a blood clot, in their 20s. So it's, even though you both have an inherited thrombophilia, they carry much different risks. Just to answer one of the questions, one of the people said, do you have to be off all the anticoagulation before getting the genetic testing? So the ones, the prothrombin gene mutation that Jessica has in the factor V Leiden, you don't have to be off the blood thinner for those. But depending on what blood thinner you have, it could affect some of the other ones. And also, I just want to point out the people that have antithrombin deficiency, like Danielle, and the two other ones, protein C and protein S. If you have an acute blood clot, you've just diagnosed with a blood clot, those levels can be falsely low. So we do really tell people to wait to get testing until they're through that kind of acute, usually within about 3 months. If you get tested and you are negative, again, having a family history is also just equally as important as being tested for one of these conditions. Definitely, strong family history as two of you have had in here. I did want to just go back, Sarah, to talk to you about, you had said, that decision around getting pregnant again after this really sounds like a traumatic experience for you, and that, emotionally that was very difficult. How can you tell us a little bit about that process and how you got through that and what helped you?
Through the emotional part of finding out that
that you were pregnant again and that you were just had this
yeah,
trauma of the blood clot.
Yeah, so I would definitely say that therapy helped me.
Yeah.
I had to accept it, that it was out of my control. And just deciding to go to therapy helped because it empowered me to do all that I do my part with regard to knowing my limitations, and stuff like that. But definitely the therapy helped because my therapist, literally all of my treating physicians and medical professionals really work together, especially at the end of pregnancy. So I would say the therapy helped me with accepting, like kind of like Jessica said, it's like you're accepting that, this has happened to you, but you also are trying to just wrap your mind around that you don't have control over it happening again. You just have to live your life.
Yeah. Yeah. Well, I'm sorry that you experienced that, and it sounds like you did have some help. And I think you and Jessica mentioned the kind of the mental issues associated with blood clots, and I think it's just as a medical field, I don't think we've done a great job of trying to really capture what that is. And So actually, there's a mental health survey that the National Blood Clot is doing called CLUES, a critical look at understanding the emotional suffering of blood clot survivors. And you can actually, I think Taryn is going to put the link in the chat. So anybody listening, you know, I think we really have to learn from blood clot survivors like you to really know the physical toll that the clots take on your body, but also the psychological impact. And I just don't think we know that, kind of the emotional issues it's caused and the anxiety and post-traumatic stress. And so I think, you know, as healthcare providers, we really want to learn from you and all people that have blood clots. Just your knowledge and opinion can really help us develop better ways to really treat the whole patient, physical and emotional. So we invite people to take part in the study. It's called CLUES, and you can see it on the website, and also it will be put in the chat so people have a link to that. Sarah, going back to the family history, now that you have the family history, how have you been talking with your family about that and exploring kind of this you know, this knowledge and how it comes to your risk as well as everyone else in your family?
It's been a challenge for my family to really accept that it's important for them to know the risk and get tested. One of my aunts, actually the one who had a history of clots, that I did know she had a history of clots, but like I said, I didn't know about mutations and all that. But she actually passed away yesterday. So you know, I wonder a little bit at this very moment if that will help bring more significance to the importance for my family members to get tested on my mom, you know, on the side of my family where the gene is. It's definitely been difficult with trying to heal. Can you guys, we're trying to heal and trying to advocate, you know, for myself and also educate those in my family that I hope that they will get tested. It's been a challenge. It's been really difficult. And like I said, with my aunt passing yesterday, I think it may bring more significance to it, maybe a sense of urgency to it, but it may not. And I haven't got my kids tested yet. I want to, but the pediatrician that they go to doesn't recommend it yet. So I don't, and because my son is 4, my daughter is 3, my infant is 8 months. So, but it's a challenge, you know, when your family has not agreed. Like one of my family members even said to me, "When did you get it?" And I was just like, "You need to get tested because I was born with it, and it's on side of the family." So
yeah. Well, I think, Sarah, thank you for sharing that. And I do want to point out that, you know, having an inherited risk factor like factor V Leiden or the prothrombin gene mutation, antithrombin 3, definitely increases your risk of getting a blood clot. We know that. Even more importantly is that family history and how to treat patients and for how long. Having the thrombophilia doesn't dictate that. It's more what caused the blood clot and whether or not you have ongoing risk. So again, in people that are listening in the audience, again, knowing your risk factors and having a conversation with your healthcare providers is probably the most important thing if you do develop a blood clot. And whether or not you stay on a blood thinner, when you need to go back on a blood thinner, maybe in high clotting risk situations, if you're able to stop it, is really going to, again, depend on what risk factors you have. Having just the factor V Leiden in and of itself, again, doesn't cause blood clots, but put you at it can put you at a higher risk of getting them. Like we said, the antithrombin, much higher risk. So again, just now it sounds like everyone is saying kind of the same thing, that knowledge is power, and really having that information. I would say we just have 1 minute. I'd like to just, Sarah, what would be your kind of take home message for the people that are listening in terms of just, you know, what's it, something impactful that you want people to walk away with hearing your story and what you've learned through all of this and this whole journey?
I would say advocate, advocate for yourself. If you know something doesn't feel right, and even when they say the insurance is not going to pay for it, even if they say you're too young to have this, not normal for young people, anything. And also to women that are going to go on birth control, something that I would recommend personally, that I have recommended to my family and friends, is if your insurance or your if you have coverage to get genetic testing done before you even go on birth control, please get it done. And that's a form of advocating for yourself, and so yeah, advocate for yourself, educate yourself, know the risk. Stop the Clot has so much resources available to us, and it's a community of us here that have the benefit of experience to help each one another. And so yeah, and if you don't feel like you're worth anything, advocate for yourself by thinking about who wants you to be here. Think about who empowers you. I need to advocate for myself because my friends want me here. Just make it beyond yourself if you have to, but definitely fight and advocate for yourself.
Well, Sarah, thank you for that. That is a beautiful way to put it. And I think to your point that if you are starting estrogen, it's important to have conversations with your providers about your personal risk. Again, family history and what other risk factors you might have that might put you at a higher risk, and maybe estrogen is not the right therapy for you. And if you do have one of these inherited thrombophilia, or you're at a very high risk of getting a blood clot, there are alternatives like the progestin only ones that are safer than the estrogen only ones. There was a question about that. So I just want to thank all of you. I mean, everyone on the panel. You are warriors. I mean, your stories are so powerful and so impactful, and I think I can speak for everybody who's listening that just sharing your stories is really helpful and enlightening, and brings to, I think a lot of people may experience what you are, and just hearing that they're not alone in this. And then just how incredibly powerful you all are in advocating for yourself and getting what you need and getting the resources you need. And I think the key take home message here are: know your risks, understand the signs and symptoms of blood clot, ask questions, make sure that you have knowledge and that you learn about this. And that if you don't know where to find it, you can come to our website and you'll find information there, and really get people that are going to hear you and listening to you, and not give up on yourself, and trust your body. I mean, Danielle, you mentioned that, just knowing that you knew something was wrong. And Jessica, you knew that maybe this person who had been taking care of you didn't have all the answers, and thank goodness they looked out and found somebody else to. And then Sarah, just you being the advocate for yourself and insisting on getting a CAT scan, which ultimately diagnosed you with, sounds like, pretty significant blood clots that obviously could have ended your life. So I think all of those messages that you all shared are so important and really inspiring. So I just want to thank all of you. And of course, I want to thank Grifols for sponsoring. And again, if you have questions, you can go to the National Blood Clot Alliance. There's a whole section on thrombophilia, in pregnancy, and just on blood clots in general. And then lastly, like I said, in the middle of Sarah's discussion, we do want to learn from you, and we want to learn about all the mental and psychological and functional and anxiety and depression, everything that might be associated with blood clots that we really don't have a great handle on. And so please educate us, and go and take that survey, which Sarah put in the chat. So again, thank you everyone for joining, and thank you for all the audience for taking this hour to listen to these three just incredibly inspiring women. So thank you very much.